Orthopedic and Traumatology Airlangga University, Dr. Sutomo Academic General Hospital Surabaya has subspecialty programs that able to provide subspecialty health services in a professional and comprehensive manner, such as promotive, preventive, curative, and rehabilitative, based on the latest scientific developments. And also we able to act as a researchers and always to strive to improve the ability of professional tasks independently, creatively, and able to provide ideas or development to solve existing health problems. We act as a planner, organizer, coordinator, and evaluate to achieve the goal of improving health and well-being.
Unair's vision to become an independent, innovative, leading university nationally and internationally, and as a pioneer in the development of science, technology, humanities, and art based on religious morality. Medical Faculty, the University of Airlangga vision to become an independent, innovative, leading faculty of medicine at nationally and internationally, a pioneer in the development of medical science and technology, entrepreneurship, and humanities based on religious morality. Dr. Sutomo General Hospital, its vision become a trusted, safe, high quality, and independent tertiary hospital. Hence, our orthopedics and traumatology subspecialist programs are hip and knee, adult reconstruction, trauma, and sport. Orthopedic oncology, hand, upper limb, and microsurgery. Spine, pediatric orthopedic, orthopedic and traumatology subspecialty program visions becoming a dignified, independent, innovative, and superior center for orthopedics and traumatology subspecialty program in the fields of education, research, and community service based on religious morality in 2025.
Orthopedic and Traumatology Airlangga University, Dr. Sutomo Academic General Hospital Surabaya has subspecialty programs that able to provide subspecialty health services in a professional and comprehensive manner, such as promotive, preventive, curative, and rehabilitative, based on the latest scientific developments. And also we able to act as a researchers and always to strive to improve the ability of professional tasks independently, creatively, and able to provide ideas or development to solve existing health problems. We act as a planner, organizer, coordinator, and evaluate to achieve the goal of improving health and well-being.
Unair's vision to become an independent, innovative, leading university nationally and internationally, and as a pioneer in the development of science, technology, humanities, and art based on religious morality. Medical Faculty, the University of Airlangga vision to become an independent, innovative, leading faculty of medicine at nationally and internationally, a pioneer in the development of medical science and technology, entrepreneurship, and humanities based on religious morality. Dr. Sutomo General Hospital, its vision become a trusted, safe, high quality, and independent tertiary hospital. Hence, our orthopedics and traumatology subspecialist programs are hip and knee, adult reconstruction, trauma, and sport. Orthopedic oncology, hand, upper limb, and microsurgery. Spine, pediatric orthopedic, orthopedic and traumatology subspecialty program visions becoming a dignified, independent, innovative, and superior center for orthopedics and traumatology subspecialty program in the fields of education, research, and community service based on religious morality in 2025.
Orthopedic and Traumatology Airlangga University, Dr. Sutomo Academic General Hospital Surabaya has subspecialty programs that able to provide subspecialty health services in a professional and comprehensive manner, such as promotive, preventive, curative, and rehabilitative, based on the latest scientific developments. And also we able to act as a researchers and always to strive to improve the ability of professional tasks independently, creatively, and able to provide ideas or development to solve existing health problems. We act as a planner, organizer, coordinator, and evaluate to achieve the goal of improving health and well-being.
Unair's vision to become an independent, innovative, leading university nationally and internationally, and as a pioneer in the development of science, technology, humanities, and art based on religious morality. Medical Faculty, the University of Airlangga vision to become an independent, innovative, leading faculty of medicine at nationally and internationally, a pioneer in the development of medical science and technology, entrepreneurship, and humanities based on religious morality. Dr. Sutomo General Hospital, its vision become a trusted, safe, high quality, and independent tertiary hospital. Hence, our orthopedics and traumatology subspecialist programs are hip and knee, adult reconstruction, trauma, and sport. Orthopedic oncology, hand, upper limb, and microsurgery. Spine, pediatric orthopedic, orthopedic and traumatology subspecialty program visions becoming a dignified, independent, innovative, and superior center for orthopedics and traumatology subspecialty program in the fields of education, research, and community service based on religious morality in 2025.
Orthopedic and Traumatology Airlangga University, Dr. Sutomo Academic General Hospital Surabaya has subspecialty programs that able to provide subspecialty health services in a professional and comprehensive manner, such as promotive, preventive, curative, and rehabilitative, based on the latest scientific developments. And also we able to act as a researchers and always to strive to improve the ability of professional tasks independently, creatively, and able to provide ideas or development to solve existing health problems. We act as a planner, organizer, coordinator, and evaluate to achieve the goal of improving health and well-being.
Unair's vision to become an independent, innovative, leading university nationally and internationally, and as a pioneer in the development of science, technology, humanities, and art based on religious morality. Medical Faculty, the University of Airlangga vision to become an independent, innovative, leading faculty of medicine at nationally and internationally, a pioneer in the development of medical science and technology, entrepreneurship, and humanities based on religious morality. Dr. Sutomo General Hospital, its vision become a trusted, safe, high quality and independent tertiary hospital. Hence, our orthopedics and traumatology subspecialist programs are hip and knee, adult reconstruction, trauma and sport, orthopedic oncology, hand, upper limb, and microsurgery. Spine.
Good morning, ladies and gentlemen. Before we begin, please allow me to extend our utmost welcome to the Honorable Rector of Universitas Airlangga, represented by Vice Rector for Resources, Professor Muhammad Madian, SE, MSE, MPhil, PhD. The Honorable Dean of Medical Faculty of Universitas Airlangga, represented by the Vice Deans of Medical Faculty of Universitas Airlangga, Sulistiawati, MD, PhD. The Honorable Hospital Director of Dr. Sutomo General Academic Hospital, represented by the Head of Medical Service Division, Molly Edward, MD, PhD. The Honorable Hospital Director of Universitas Airlangga Hospital, Professor Nasruddin, MD, PhD. The Honorable Special Staff to the Dean, Dr. Hanifah Erlin, MD. The Honorable Chief of Office of International Affairs, Faculty of Medicine, Universitas Airlangga, Asra Al-Fauzi, MD, PhD. The Honorable Head of Department of Orthopedic and Traumatology, Dr. Sutomo General Academic Hospital, Triwahyu Martanto, MD. The Honorable Study Program Coordinator, Teddy Heriwardana, MD. The Honorable Professor Nicholas Budiparama, MD, PhD. The Honorable Heads of the Departments, Study Program Coordinators, Professors, Doctors, Staffs of Faculty of Medicine, Universitas Airlangga, dearest residents, and last but not least, our distinguished adjunct professor, Professor Rob G.H.H. Nelissen, MD, PhD, and also to all our distinguished guests. Good morning, ladies and gentlemen. And before we proceed to the main event, shall we recite our praise for Allah subhanahu wa ta'ala for his blessings for today as we have gathered here today, healthy and able to participate on this honorable event. Welcome to the Medical Faculty of Universitas Airlangga. And on this precious opportunity, the Medical Faculty of Universitas Airlangga has proudly invited Professor Rob G.H.H. Nelissen, MD, PhD to Surabaya. And it is a great honor for us to welcome our distinguished adjunct professor, Professor Rob G.H.H. Nelissen, MD, PhD, today, July the 13th, 2023, on the adjunct professor inauguration ceremony held by the Medical Faculty of Universitas Airlangga. My name is Twindi Rarasati as the host for this morning event. And before we proceed, please allow me to elaborate our rundown for today. And first, after the opening, will be continued by the national anthem of Indonesia Raya and hymn Airlangga, curriculum vitae reading, opening speech by the head of Department Orthopedic and Traumatology, welcome speech by the Dean of Medical Faculty of Universitas Airlangga, and followed by scientific oration, speech by the Rector of Universitas Airlangga, inaugural address by the Rector of Universitas Airlangga, and last closing with photo session. Before we begin, as our love and pride to our beloved homeland, Indonesia, and to our alma mater, Universitas Airlangga, shall we sing the national anthem, Indonesia Raya, followed by hymn of Airlangga. Please raise up. Thank you. You may please return to your respective seats. And I'd like to extend our welcome to the Chairman of Academic Senate, Professor Joko Santoso, MD, PhD. The following agenda is Professor Rob Nelissen's curriculum vitae reading by the Chief of the Office of International Affairs, Faculty of Medicine, Universitas Airlangga, Asral Fauzi, MD, PhD.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, all professors and doctors. On this extraordinary opportunity, allow me to read a short CV of Professor Nelissen in this inauguration ceremony. Currently, Professor Nelissen, MD, PhD, is Currently, Professor Nelissen, MD, PhD, is serving in well-known university in Netherlands, such as Leiden University Medical Center, as a professor and chair department of orthopedics, and also medical delta professor at the Department of Biomedical Engineering, Delft University of Technology. Professor Nelissen completed his medical degree at Leiden University in 1985. Then, 8 years later, took a fellowship in total joint at UCLA, Toledo, USA. He obtained his board certification as an orthopedic surgeon from LUMC in 1994. 10 years since he earned his PhD from Leiden University in 1995, he was appointed as a professor of experimental orthopedics at the same university. Then, in 2006, he served as a professor of orthopedics and chair of the Department of Orthopedics at LUMC. In addition, since 2016 until now, he is also the medical delta professor at the Department of Biomechanical Engineering, Delft University of Technology, Netherlands. Because of his integrity and expertise, he has been appointed to occupy various important positions and carry out professional services at various leading institutions, as shown in the slides. Apart from being the founder and chair of the Dutch Arthroplasty Registry from 2006 and 2022, he has also served as the president of the Netherlands Orthopedic Association for 4 years since 2014. By exploring his area of expertise, he has produced more than 450 papers that are Scopus Index, with a total of more than 200,000 citations, which makes him have an H index of 72, and has become a mentor for more than 60 PhD students. can be seen at the bottom of the slide are 5 of his most relevant articles. Professor Nelissen, during his academic career, has research programs in orthopedics, trauma surgery, and rehabilitation, with the main theme of mobility. Thanks to his brilliance of his academic career, it is not surprising that in the end, Professor Nelissen has received several prestigious grants in the last 2 years. He has even received grants of more than 6 million euros from various institutions. With his unquestionable experience, the expertise of Professor Nelissen as a leader has also been tested. At least he has led more than 15 major institutions, including the DG Sante EU Commission, Biomedical Alliance in Europe, Dutch Orthopedic Association, Dutch Orthoplasty Register, and many more. We can see all of them in the next 3 slides. Indeed, because of limited time, it is impossible for us to discuss all of the achievements that have been achieved by Professor Nelissen all this time. But at least with these few slides, we can get to know him more closely. We can also take inspiration and valuable lessons for his dedication and the extent to which he has devoted himself to the world of the medicine, especially in the field of orthopedics. Thank you for the attention. Again, thank you very much. Thank you.
We would like to welcome our utmost gratitude for your presence, sir, the Dean of Medical Faculty of Universitas Airlangga, Professor Budi Santoso, MD, PhD. And next, the opening speech from the head of Orthopedic and Traumatology Department, Dr. Triwahi Martanto, MD.
Assalamualaikum warahmatullahi wabarakatuh. Our Excellencies, Rector Universitas Airlangga, represented by Professor Dr. Muhammad Mahdian, PhD, Excellencies, the Dean of the Medical Faculty, Universitas Airlangga, Professor Budi Santoso, the Vice Dean, Dr. Sulistiawati, and Professor Dr. Joko Santoso, MD, PhD from the Senat Airlangga, the Director of Dr. Sutomo General Academic Hospital, Surabaya, represented by Dr. Molly, our special guest, Professor Rob Nelissen from Leiden University Medical Center, and all distinguished colleagues, guests, ladies and gentlemen. A very good morning and warm welcome to all of you. First of all, I would like to express my great gratitude to Allah Subhanahu wa Ta'ala for giving us some blessing and measures so we can gather in this meeting in good situation and condition. Today is the day of celebration for our institution as we welcome Professor Rob Nelissen from Leiden University Medical Center as a part of our family. It is a true pleasure for me to welcome you to the very great session of the adjunct professor inauguration today. The Department of Orthopedic and Traumatology, Faculty of Medicine, Universitas Airlangga, has forged a long and good history with the Department of Orthopedics, Leiden University Medical Center. The beginning of mutually beneficial journey was initiated by Professor Nicholas Budivarama and Professor Dikora November Utomo, who had a close relation with Professor Rob Nelissen. The nurtured relation grew deeper into academic collaboration. Here are some of the academic collaboration between both departments. First, we have sent some of our staff, Dr. Muhammad Harjan Basuki. Are you around? No. Oh, Dr. Harjan, on behind Professor Nelissen. And Dr. Yunus are the oncology fellowship training, and Dr. Kukuh Dwiputra Herdugrahanto for arthroplasty fellowship training in Leiden University Medical Center, Dr. Kukuh. Okay. Second, we also hosted a research student and orthopedic resident from Leiden University Medical Center in our department for research and clinical fellowships under Dr. Heri Suroto. Some of our staff, such as Professor Nicholas, Professor Dikora in arthroplasty research, and Dr. Heri Suroto in brachial plexus injury research, have also co-authored a joint publication with Professor Rob Nelissen, who has 30 years of research experience with a remarkable age index of 72. Let's give Professor Rob a warm round of applause. Therefore, today is another milestone to mark the long-standing journey with the Leiden University Medical Center. We sincerely hope that the academic collaboration will continue deeper and further in teaching, research, student exchange, and other academic fields that will definitely benefit both institutions. Lastly, please allow me to acknowledge that thank the Dean, the Inauguration Committee, the Office of the International Affairs, all staff, and everyone involved for their works in making this a memorable event for all of us. I thank you very much and look forward to a fruitful opportunity. Wassalamualaikum warahmatullahi wabarakatuh.
And the following agenda is the welcome speech by the Vice Dean of Research and International Relation of the Faculty of Medicine, Universitas Airlangga, Sulistiawati, MD, PhD.
Assalamualaikum warahmatullahi wabarakatuh. The Honorable Rector of Universitas Airlangga, represented by Vice Rector, Professor Muhammad Madian. The Honorable Dean of Faculty of Medicine, Universitas Airlangga, Professor Budi Santoso, and the Director of Dr. Sutomo General Hospital, represented by Dr. Mauli, the Head of Department of Orthopedy and Traumatology, Faculty of Medicine, Universitas Airlangga, Dr. Tri Wahyu Martakto, and our senior, Professor Joko Santoso, Professor Nicholas, and all audience in here. A very good morning to all of you. It is my great pleasure, and on Faculty of Medicine, Universitas Airlangga, I would like to say thank you and welcome to all of you in this prestigious event of the adjunct professor inauguration ceremony of Professor Prof. Nelissen, MD, PhD from Leiden University Medical Center, or we call as LUMC. Prof. Nelissen is expert in arthroplasty, brachial plexus injury, and oncology. So this is a good opportunity for our staff and our students also in Faculty of Medicine, Universitas Airlangga, because Professor Nelissen can share his experience, especially in complex arthroplasty and reconstructive oncology. But after discuss today, this morning, I think Prof. Nelissen also expert in study design of research in randomized clinical trial, and also how to make a critical thinking. I think so, not just for from Department of Orthopedic, but also can collaborate with our master program degree, PhD program degree in Faculty of Medicine. Of course, I think many students can join with the lecture of the Prof. Rob. We sincerely wish what this inauguration will mark the beginning of the mutually beneficial and invigorating journey between both institutions, between Faculty of Medicine, Universitas Airlangga, and also with LUMC. I would also like to extend my gratitude to all staff of Department of Orthopedic and Traumatology and all of the committee for the effort to make this collaboration and event possible. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
And the following agenda is the welcome speech by the Dean of the Faculty of Medicine, Universitas Airlangga, Professor Budi Santoso, MD, PhD.
Bismillahirrahmanirrahim. Good morning. Assalamualaikum warahmatullahi wabarakatuh. The Honorable, the Head of the Airlangga University Senate, Professor Joko Santoso, and the Honorable Director of Universitas Airlangga, representative by Professor Madian, and the Head of the Department Orthopedic, the Program Study of Orthopedic, and all staff and the resident of the Orthopedic Program study program, and especially our guest, Professor Nelissen from the Leiden University. Welcome to our campus. And now we are standing in the heritage building that with the Netherlands architecture. And also Professor Nicholas that have the a big contribution for our collaboration between Faculty of Medicine, Airlangga University, and Leiden University. Thank you, Prof. Nicholas. On behalf of Faculty of Medicine, I would like to say welcome for Professor Nelissen, Professor Nicholas, and all of the participants in this morning lecture from the Professor Nelissen. And I hope this will be useful for us, and especially for the orthopedic department Airlangga University, Dr. Sutomo Hospital. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, the following agenda is the scientific oration by Professor Rob G.H.H. Nelissen, MD, PhD, titled Quality Assessment, Essentials in Orthopedic.
vice-rector Universitas Airlangga, Leiden, Professor Leiden, Ketua Senat Professor Joko Santoso, Ibu vice-decan G.H.H en Bapak dekan Budi Santoso, en dan para hadirin. Saya merasa terhormat diundang menjadi adjunct professor Universitas Airlangga. And I would like to talk in English. It's already an effort. Terima kasih. Can I have the first slide? So I would like to share with you my thoughts on the quality assessment in orthopedics. It's not only in orthopedics, but it's also valid for the rest of the field. We as doctors, we function because we like, let's see, it's moving slowly, I think. It's the whole thing. The reason we are doctors, we like to improve patient care. We like to have happy patients, and that's the reason we are doctors. The very simple thing. But sometimes we have to look at it from a different perspective. When you are the manager of a hospital, you have a different perspective than the dean of a faculty or the rector of a university. And when you are the patient, you also have a different perspective from what you expect from surgery or from treatment, from splints, from medication. So the perspective of yourself will have an effect on how you evaluate things. That's very important. And in general, we can see that musculoskeletal problems worldwide are a big problem. It's one of the major problems globally when you look at musculoskeletal problems. Not only joint disease, injuries caused by accidents, traffic accidents, trauma, but mainly the disasters we have in musculoskeletal disease, as osteoarthritis. When you look at the world map, it's a very interesting article from the Lancet. You see when you look at South Asia, next to it is Europe, you see that especially the top 3 of all surgeries, of the 300 million surgeries, are mainly done by musculoskeletal problems, injuries and musculoskeletal disease. And you can see also in Southeast Asia, that's a big chunk. When you include the injuries, it's even more. But when you look at the high income countries in Asia, like Japan, you see there's a huge increase of musculoskeletal disease, like osteoarthritis. And that's probably due to the fact that obesity is increasing. So it's good for the orthopedic surgeons. They have a job, but bad for our patients. And when you look at the US, it's the same problem. So even in the US, you see that people, when they spend more money, they tend to get obese, except there's a difference in Europe. In Europe, we try to keep that down. So that's something for us as surgeons and orthopedic surgeons and rheumatologists and different fields to improve. And obesity also leads to inflammation, to disease of the bowel system. So I think in the end, we as orthopedic surgeons are in the lead to solve a lot of problems, also cardiovascular disease. Well, so due to this increase in musculoskeletal diseases, we need some innovation. It's very important to think how to look for prevention, how to have better techniques in diagnostics, how to give better treatments like surgery, and that's nice. When you look back 100 years ago in Leiden, this was the operating room 100 years ago, and that was the operating room just already in 2021. We have computer navigation, we have CT scan in the operating room, so very high tech. That's very interesting. And you see during the last 100 years, a lot of things have changed, and mainly in the 19th century, antisepsis. That's the reason we can do surgery. And anesthesia is also the reason we can do surgery. But you can also see that heart surgery improved, new hip, endoscopic surgery like arthroscopies like 50 years, robotic surgery, AI, well, fantastic. We can improve health for patients. And a funny and interesting thing is also old-fashioned things are huge inventions. When you look at the impact of just a simple plaster, which was developed by the Egyptians 5,000 years ago, has a huge effect on how we treat patients like the club feet, or simple harness like the Pavlik is still used even in 2023. So these are also very important innovations which are very low cost, but has a huge impact on society. So this is very, very nice. And we think now the last few years on personalized medicine, personalized orthopedics. We have this very difficult case like fiber dysplasia with crooked shepherd hook legs. We can treat them. We have very fancy operating tools with surgical guides. We have computer navigation, and then we have very nice bone. When we have bone tumors, we have very nice 3D modeling. We see already the tumor before, when you put 3D printed implants in, and we have computer navigation, and the patient can be treated very well. That's very nice, good for those patients. But bone tumors in the Netherlands, it's perhaps 1%. A general practitioner in the Netherlands sees a bone tumor every 20 years. An orthopedic surgeon every 10 years, and that's probably the same in Indonesia. However, you have a much bigger country. You have about almost 300 million people. We only have 80 million. That's nice. But also the very simple total hip, which is around, is a very nice innovation. And it was actually called the best innovation of the 20th century. So we are very happy as orthopedic surgeons. That's very important. And we see that a total hip can add to life qualities. A lot of quality of life added in several articles across the globe. That's a very nice invention. But we also see that there's improvement. These are data from the Dutch Arthroplasty Registry. And we have now 1.1 million implants in. We see that during the years, there's an improvement of 0.5% in lateral revision of hips. And when you look at knees as well. So when you look at around 40,000 annual, that's a big, impressive thing for society, less revision. So we have more benefit for the patient than risk. But sometimes there is also risk. We know when we put a total hip and total knee into a patient which is 50, 55 years old, the lifetime risk for revision is 35 to 40%. That's a lot. It functions well at 70 years and 80 years, but in younger age, 35, 1/3 will have a revision. That's bad. And of course, that's the reason we have innovation. We try to improve our products. Sometimes they're worse, like this knee implant was worse. Sometimes improvement. And what we actually aim is orthopia, the best performing implant. But does it exist? Does that really exist? It doesn't exist. And we know the bad things what happens. Only 12 years ago, we had a big disaster on the metal and metal. And we had huge revision rates. And we know that the revision rate of those metal implants at 5 years were more than 4 times higher than from the simple regular hip. So innovation can cause problems. And that's the reason there are more problems, not only in orthopedics. We had also problems with in the general surgery, with the heart valves, the Björk-Schiley valves in the 90s. We also had the deep power modulation in gynecology, which caused a lot of problems. We missed tumors. We had the pacemaker leads only 6 years ago, which were problems. We also had the vaginal meshes, which are causing a big problem worldwide. And also the modular necks recently. So some things are worse. And that's the reason society demands from us, from investigator journalists 5 years ago, that published reports that the medical field is not taking the lead in evaluating in a well-established way their products. And it's our responsibility to improve this. We need critical thinkers. We need innovation with critical thinking. That's very important. And we have to be in the lead, not they. And that's the reason the European Commission have a new law. I think it's to improving patient safety. And the interesting thing is that this new EU law means that we need clinical evidence before a product is put on the market. In the US, FDA doesn't recommend this. So it's actually very strange that we know the first time we have clinical evidence needed for new innovative products. That's a good thing. So in the end, when you are a surgeon or a doctor, you think, which implant should I use? And it's still happening that these are the implants of 250,000 total knee implants. You can see from data, you can't read it, but the red lines and the green lines are the good ones. The red ones have a 4 times higher revision, 15% versus 4%, the best performing. So when you're in the 6,000 patients who had a worst performing, you need a revision. And when you are in the ones with the best performing, you still can walk around. And in hindsight, of course, the industry doesn't mean to have bad products, but it happens. So even in the Netherlands. That's a recent research we did. And you can see the bad thing is that randomized controlled trials before a product was certified with CE was only a very low figure, only 9%. That's amazing. And that's the reason with the EFORT, we have this guidelines just published 3 weeks ago. We have some recommendations for the orthopedic surgeons, at least in Europe, globally. The first society who has this, to do this, that's what we did in May. So that's the reason I couldn't be here. And so this is still happening, like a marketplace. That's a bad thing. What we need implants or any medical technique which is done on past performance. Just prove that it's really evidence. So what is your perspective? Is your manager's perspective? He wants to have low cost implants. Is the society, they want low revision rates. That may mean expensive new implants. It's the perspective of the patients. The patient doesn't want to have complications. And we as doctors, we want to have happy patients. So your perspective is very important. That's the goal, this happy patients. And sometimes we as surgeons, we need some glasses. Sometimes we do not see things. We need to make things more clear for them, to see the vision, what is important. And then equipoise comes around. Probably that actually means that surgeons, we do not have a clue what it is. And that's the reason we need this. That actually means there is insecurity about the outcome by researchers, patients, and also the doctors. Then you need a randomized controlled trial. And then we have the best balance between good and bad things. Another thing is that when we have something, we tend to believe that our babies are never ugly. We also know that we may have children. I have 2 daughters. They are very nice. The best daughters in the world, of course, my daughters. But we need to address that sometimes our products can be less important. So we have to acknowledge this. It's a very nice paper in the British Medical Journal. Sometimes our baby can be ugly. And we have to say, well, we have an ugly baby. So we have to change things. So in the end, we want to have happy patients. And the Dutch way to do is to give feedback, active feedback to surgeons. And when we did this, we saw that we had less revision, we had less complications, so 24% more improvement by just giving active feedback to the surgeons. Because the surgeons, they like to do their best, but they need some information back. That's important. In the end, it's very complicated. New techniques, new implants, new surgical techniques or medication. It's a very close interaction between the surgeon, his products, his new intervention, and the patient. And it's about basing our decisions on evidence. And then also, because we are surgeons, we need good surgical skills. In the end, it's about, when I look in the mirror, am I the best surgeon with this best implants, instruments, and staff to perform the optimal surgery for my patients? That's the question you have to ask every day when you look in the mirror, or when you're just scrubbing for your surgery, or when you're just an internal medicine doctor, look in the mirror. Am I the best person to do this treatment for this patient? And the reason why I'm very, very happy that I have this adjunct professorship at Airlangga, and Matur Nuun Sangat.
Ladies and gentlemen, shall we continue the agenda? The following is the speech by Rector of Universitas Airlangga, represented by the Vice Rector for Resources, Professor Muhammad Madian, SE, MSI, MPhil, PhD.
Bismillahirrahmanirrahim. To our honorable guests, Professor Prof. Nelissen, the Dean of Faculty Medicine, Airlangga University, Professor Budi Santoso, Vice Deans of Faculty of Medicine, the Professor from Medical Faculty, and Professor Joko Santoso as Head of Academics Senates, the Professor of the Faculty Medicine, Universitas Airlangga, the Head of Department, especially Orthopedics, the Director of Hospital, all distinguished guests, respected colleagues, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. And very good morning to all of you. On behalf of Rector of Universitas Airlangga, allow me to officially welcome Prof. Nelissen from Leiden's University Medical Center to our university. In accordance with university's blueprint to be one of the respectable and renowned university in the world, Universitas Airlangga is on its journey to expand its network throughout the world, including Europe. Leiden University and Leiden University Medical Center have become strategic partners to Universitas Airlangga. Numerous collaboration between both institutions have been well established with mutual objectives to improve the academic achievement and excellence of Universitas Airlangga. Exchange of ideas between both institutions have benefited both parties. Today, we are very grateful that our strong relationship with Leiden University will take one step further as we welcome Prof. Nelissen to join us today. Considering his vast network and academic experience, we believe that his presence will definitely have positive impact to Universitas Airlangga. As we can hear from his oration, we indeed agree that innovation is crucial to offer the best service to our society. However, we also realize that innovations come not only with peers, but also pitfalls that might be unintentionally harmful. Therefore, it is imperative that innovation must come with responsibility of proper evaluation to keep the spirit of consistent improvement for the better service. This idea is practical and can be generalized to all aspects of life, not only in orthopedics and medicine. We do hope that the spirit of improvement will continue to light and spark even brighter with good collaboration with respectable individuals and institutions. Before we end our speech, we would like to thank every single hand that has contributed to the success of this event. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
And now we have reached the main event for today's agenda, the inaugural address by the Vice Rector for Resources, Faculty of Medicine, Universitas Airlangga, referring as the adjunct professor to Professor Prof. G.H.H. Nelissen, MD, PhD. We respectfully invite to come forward the Rector of Universitas Airlangga, represented by the Vice Rector for Resources, Dean of Faculty of Medicine, Universitas Airlangga, represented by the Vice Dean, Professor Rob G.H.H. Nelissen, MD, PhD, and the Head of Orthopedic and Traumatology Department. Please come forward and grant the awards of honor to Professor Rob G.H.H. Nelissen, MD, PhD. The Vice Rector for Resources of Universitas Airlangga will symbolically hand the flower of honor to Professor Rob Nelissen as the adjunct professor of Universitas Airlangga. The Vice Dean of Medical Faculty of Universitas Airlangga will symbolically hand the placard of honor to Professor Rob Nelissen as the adjunct professor of Universitas Airlangga. The head of Orthopedic and Traumatology Department will symbolically hand the certificate of honor to Professor Rob Nelissen as the adjunct professor of Universitas Airlangga. A big one round of applause, please. And thank you, and also congratulations to Professor Rob Nelissen, MD, PhD, and you may return to your respective seats. And that was our last agenda for this special event. After this, we're gonna have a photo session with all the guests, all the honorable members of this audience today. Please come forward, maybe. Professor Rob G.H.H. Nelissen, and everyone, the head of departments, all orthopedic and traumatology seniors, residents, Professor Nicholas,